Hello, I'm Leslie Davis, Senior Vice President of UPMC and the Executive Vice President of the UPMC Health Services Division. I've been a leader at UPMC for 15 years, and I want to thank you for choosing UPMC for your care. Our team of doctors, nurses, and staff are experts in innovation and quality while treating you with compassion to make sure you have the very best experience. We have a great team, and this video you are about to watch will help you prepare for your procedure. You and your loved ones are part of your care team too. So please, ask questions and share any needs or concerns you have. I promise we will do everything we can to take excellent care of you and your family.
This video will provide an overview of what you need to do before the surgery and what you can expect on the day of your surgery and your discharge. For children having surgery, this information will be helpful to parents and caregivers. Before your surgery or surgical procedure, a nurse will call you with important information about what time to arrive at the hospital and when to stop eating and drinking. If you take any medicines regularly, ask the nurse if you need to make changes before your surgery. If you have questions about parking or any additional concerns, let them know. If you are having outpatient surgery, you cannot drive home. Plan for a family member or other adult to drive you home. If you are taking public transportation, you must have an adult with you. We recommend you have someone stay with you for 24 hours after your surgery. UPMC has procedures in place for your safety. You will notice staff checking your name band often and confirming your name and date of birth. You also will see staff document your care in the computer so they can communicate with others about your needs. All surgeries have risks. Common risks include blood clots, infection, bleeding, nerve injury, and problems with wound healing. Your doctors will explain the risks associated with your specific surgery and with anesthesia. It is important to follow the instructions of your doctors to reduce the likelihood of these things occurring. Once you address any questions or concerns with the doctors, you will be asked to sign the informed consent forms. You may have already signed them at the doctor's office. Before your surgery, an anesthesia specialist will meet with you to discuss anesthesia, which is used to relax you and block pain. There are several types of anesthesia used for surgery. Local anesthesia numbs a small part of the body for minor procedures. You may get a shot or cream applied to the area to block pain. You may stay awake during the procedure. Regional and neuraxial anesthesia blocks pain to a larger part of your body. You may also get medicine to help you relax or sleep. Types of regional anesthesia include a nerve block, which is a shot of anesthetic to block pain around a specific nerve or group of nerves. Nerve blocks are often used for surgeries on the hands, arms, feet, legs, or face. Epidural or spinal anesthesia, which is a shot of medication near the spinal cord and the nerves that connect to it. It blocks pain from an entire region of the body, such as the belly, hips, or legs. Conscious sedation helps you relax and makes you sleepy, but often you are not completely asleep. It is usually given in a vein by IV. This type of medication allows you to recover quickly from your procedure and return to regular activities sooner. General anesthesia affects your brain and the rest of your body. You may get some anesthetics through an IV in your vein, and you may also breathe in some anesthetic. You will be asleep and won't feel pain during the surgery or remember it afterward. The type of anesthesia used depends on your past and current health and the type of surgery. Major side effects are not common with anesthesia, especially if you are in good health. When the procedure is complete, the anesthesia medications will be stopped. How quickly the anesthesia wears off depends on the anesthesia used, your age, your health, and on your response to the medicines. Everyone is different. After surgery, you will be taken to the recovery room. A nurse will check your vital signs and any bandages and ask if you are having any discomfort. If you are, don't be afraid to say so. Some effects of anesthesia may last for hours after surgery. You may experience numbness or less feeling in parts of your body, lack of muscle control or coordination, shivers and feeling cold, a dry mouth or sore throat, headache. For some surgeries, you may go home the same day. If your surgery is more complicated, you may have to move to a hospital room to continue your recovery. If you stay in the hospital, your doctor or nurse will visit you to check on your recovery and answer any questions you have. Whether you recover from your surgery in the hospital or at home, you can play an important role in your own recovery by following a few simple steps. Speak up. You know your body better than anyone. If you are worried about a symptom or side effect, tell your care team. Don't be afraid to ask the care team who they are and why they are there to help you. If you've been discharged, call your doctor's office. Caregivers are also encouraged to speak up on behalf of the patient. Before getting out of bed, call for help. When you're able, sit up first, then stand up slowly. Wear non-skid socks, slippers, or shoes. Clear a safe path so you have plenty of room to move around. For children in a crib, keep the crib rails up. After surgery, you may be at risk for a blood clot, which can be very serious. Prevent blood clots by moving around in your bed, room, or hallway, wearing special stockings, and taking medications if ordered. Wash your hands, especially before you eat and after using the bathroom. Ask members of your care team to clean their hands if you don't see them doing it before they care for you. We care about your pain and want to help you understand different options to treat it, but your pain may never be zero. We will ask about your pain level so we can best manage it with different types of pain medicines. Activity may increase your discomfort, and we are here to help you move around more comfortably. Protect your skin. Change your position in bed often and move around as much as you can to prevent bed sores. Check your skin every day and keep it clean and dry. You will receive discharge instructions which contain important information to help you continue your care after you leave the hospital. Please have a caregiver who will help you at home be present to learn about your discharge needs at home. Ask the nurse when your caregiver should come in for teaching. Many patients may also receive prescriptions for medications. The nurse will review your medication list with you to make sure you understand how to take them at home. Ask questions if you have them. Your doctor will want to make sure you are doing well after your surgery. It is very important to make a follow-up appointment with your doctor as directed.
Thank you for watching. We want to hear from you during your stay, so please tell your care team if we can do anything to make you more comfortable. And once you are home, if you receive a survey from us, we would be grateful to hear more from you about what went well and how we can improve. You inspire us to be the best we can be. So once again, thank you for choosing UPMC.